The O shot is the injection of platelet-rich plasma that contain growth factors from the client or the patient's own blood to be injected in a certain areas in the female intimate areas. In the female in certain points in the female intimate areas with the purpose to cause rejuvenation by increasing the blood flow and getting the builder cells like stem cells, the fibroblasts, to lay down a new, youthful, fresh, healthier tissue that can function as well as return of the normal appearance and strength. This is a non-surgical natural way of rejuvenation. It's a principle. So it's non-surgical that can treat gynecological symptoms that used to be having only limited choices like surgery or conservative or hormonal. Now, these symptoms like urine leakage, diminished sensations, and laxity of the intimate area or the vaginal part. So there were no other ways except the 3 traditional ways I mentioned. But now with the non-surgical ways, we can treat all these problems that can happen after childbirth or at menopause. Everyone above 25 years old, because as I said, you can use it as a treatment after the incident. You know, ladies, they go through many events through their lives, starting from childbirth that mechanically changes the anatomy and the stretchability of the tissue. Also, during, they have operation in these areas or at menopause or declining estrogen for many reasons, like God forbid, after chemotherapy or radiotherapy, many skin diseases affecting this area. So all this O shot can treat all these things. Also can be used as prevention. Say, instead of waiting for the problem to happen, because it's aging process, isn't it? So by aging is actually weakens the tissues and reduces the blood flow. So if we can keep, say, every year having the O shot, of course it will maintain the strengthability and functionability of the tissue. Functionability of the tissues. That's brilliant. Yes, that's what I'm really talk to every lady about, the success rate or the expectation from that. Definitely they will benefit, but the variation depends on individuals, isn't it? So, for example, and many other factors, the duration of the problem, the general condition, many things really interfere with how much this lady will benefit from one session. She might need more than one, of course. Depends on the degree of problem. And case selection is very important because that's why gynecological assessment is very important, because it might not be at all suitable. And with the counseling, for myself, I can tell her that success rate will be like that. And for me as expert in this, I can get the maximum success rate for her. I know how can I do that. So it's very variable, basically. There is no allergic reactions or anything at all. But it's the expectations of the patient that really need to, that depends on their assessment, gynecological assessment. Very important. There are degrees of this problem I mentioned before. Also, it must be done by specialists, because it's very important. Because if you would like to maximize the success rate, you have to know in the case selection and the procedure as well to be done by specialists.